Welcome to Pharmacy Friends. We bring industry experts to the same table to talk about what is happening in pharmacy today, what is coming, and most importantly, what it means to you.
Millions of Americans took to voting booths this week to decide who will be the next president of the United States. And here we are, the morning of November 7, just 2 days after the historic election, to talk with two experts from the Prime Therapeutics Government Affairs team about the overall election and possible impact to our country's healthcare system.
There's also a lot of pent-up demand for legislation, including PBM legislation that may ride with this must-pass funding bill. And there are a number of healthcare programs whose funding expires at the end of the year.
What we're watching is patent reform. And while historically that has had maybe not the most popularity as a potential drug pricing policy in Congress, we've seen some things that indicate kind of a sea change in how we view that, and it's increasingly looked at as table stakes in this area.
I'm your host, Maryam Tabatabai. You'll hear from Caitlin Berry and Julie Cantor-Weinberg as we chat about the significance that these results may have in America's history and how this election could impact the healthcare industry. So let's get right into the conversation and learn more. All right. Well, this has certainly been a historic election. A sitting president stepped aside in favor of a sitting vice president, running against a previous president who is now our president-elect. And that's the top of the ticket. Certainly, congressional races are consequential as well here. So, Caitlin and Julie, you're part of our government affairs powerhouse team, and I'm so excited that you're here with me today to unpack all this and kind of explain the potential impact on healthcare. So, maybe just to kick it off, if you want to tell us a little bit about yourselves, Caitlin.
Yeah, obviously my name is Caitlin. So happy to be here, Maryam. Thank you for asking me to do this along with my colleague, Julie. I've been in the healthcare industry for about a dozen years, health insurance and pharmacy benefit manager companies primarily. And I've been with Prime for 7 years and doing government affairs work for about 3 years now.
Thanks so much, Maryam, for having me. It's a delight to do anything with Caitlin. I've been with Prime for almost 9 years and have been working in health policy and advocacy for 3 decades for a variety of entities throughout the healthcare supply chain.
Fabulous. Well, for starters, Caitlin, maybe just start us out by, kind of explaining what the role of healthcare, the role that healthcare played, I guess, in this election.
Yeah, that's a really good question. I think for those of us who have carefully followed this election cycle, very nerdily in my case, we kind of have noticed that it has not played, for the most part, an outsized role. Other issues kind of dominated the talking space. But the one thing you could say is that I think Democrats really did lean into healthcare as an issue, but it certainly wasn't even one of their top ones. So it has been definitely interesting to watch. But yeah, I think we will see a lot of impact, though.
And what are some of the issues that you guys have been tracking, leading up to this election? Maybe if you could just briefly tell me about them.
Sure. Well, certainly drug pricing is a key issue for us as a PBM, and there's been a lot of congressional activity, and we've been watching the candidate stances on this issue. The continued implementation of the Inflation Reduction Act and the candidates' stances on that, as well as the Affordable Care Act and Medicaid. And anything you want to add?
Yeah.
Yeah.
Anything on your radar? Yeah.
Yeah, of course. So I think reproductive health has been something that many folks have viewed as impacting elections since the Dobbs case, and certainly was viewed as having an impact in the last midterm election, and was viewed as something that was on voters' minds this year. Another thing I really focus on pretty heavily is state activity and campaigning on drug pricing policy, and in particular, PBM reform.
Great. Well, let's dig into some of these issues in just a little bit more detail in a moment. But Caitlin, you and I have previously chatted about, how as we go into this election, right, it's been a difficult environment for policy discussions around PBMs in particular. Maybe explain that a little bit for our listeners.
Yeah, of course. So first, I think media attention is something that has been at an all-time high for PBMs in particular, but drug pricing in general. So for those of us who read all these many articles and pay attention to industry news, we've noticed like a real solid uptick and high influx over the summer and the fall of articles in national and regional news outlets who are kind of focusing on criticizing the business practices of pharmacy benefit managers. I think a lot of us in this kind of role expect or suspect that much of that activity is driven by stakeholders in the drug supply chain and elsewhere who are looking to the lame duck period, which Julie will talk about, to see some PBM reform passed. Not only that, but those articles really serve as a support for state level advocacy for many of those same issues. And a lot of this media attention is really directed at the big three organizations in our industry. And while Prime is not one of those, and we are different in a lot of ways from those other organizations, a lot of the legislation that's being sought in response to many of these articles would also impact us and our clients and their members. The other thing to note is there's been some high profile regulatory activity. So the Federal Trade Commission started what's called a 6B study of the PBM industry a couple of years ago now, maybe almost 3 years ago. Julie might know that more than me. And, that has been kind of an ongoing effort. And at the same time, and also Julie could speak more to this, there have been a record number, I think, of hearings in Congress about PBM issues. And there's a lot of crossover between some of those hearings and some of the pressure that was being put on the FTC to release the study, to finish it, or at the very least to release an interim study or an interim white paper that kind of summarizes their findings so far. And so in that highly politicized environment, that report came out over the summer. It was pretty critical of the PBMs that were studied, and in particular, again, those big three organizations. And we've already seen that report be used to justify a lot more discourse and policymaker discussions on PBM reform.
Really interesting. And Julie, anything to add to that?
I believe the study started in 2022. There were a lot of congressional requests for the FTC to study PBM, as well as legislations that didn't pass the Congress that would require a study, and the FTC got ahead of that. And just so our listeners know, we in Washington and in health policy and advocacy circles have way too many acronyms and abbreviations, but the lame duck is the period after the elections, before the next Congress, where members are coming back to vote. Some will be in the next Congress, but there are a lot that lost their election or are retiring. They may not have any staff. They're working in the basements of congressional office buildings. So it's sort of a crazy time.
Great. No, it's really helpful to get your DC perspective on all this too, Julie. So, I should emphasize that at the time of this recording, right? So this is kind of what we know. Donald Trump won the presidency, right? Republicans flipped the Senate, and it seems more likely than not that Republicans will have control of the House. But again, we won't know this for sure for some time. So it's all very fluid. But kind of based on what we know at the time of this recording, again, with all that in mind, Julie, right? What does that mean for, I guess, those first days of the Trump administration? Kind of at that, when you think of it through that federal lens, I guess.
Sure. Well, one of the most important things that any president does is determine the people who will be running his administration. And he gets to nominate those people, but it is the Senate's constitutional duty to confirm them. Now, obviously, not everyone that serves the president has to be confirmed, but cabinet officers like the Secretary of Health and Human Services and the agencies within HHS, such as the FDA, the CMS, et cetera, those heads have to be confirmed. And due to a law change at the beginning of next year, for the first time ever, the head of the Centers for Disease Control will also have to be confirmed.
That's quite interesting. That's thanks for sharing that kind of update too, right? On the CDC front, we'll certainly be following along. So, and then how then, is the Biden administration likely to respond to this change, Julie, kind of, the change in guard?
Sure. So the Biden administration is probably going to try to rush as many regs out as possible. Those are called midnight regs because they're issued in the waning hours of an administration. However, Republicans, if they don't like these Biden last minute regs, have a mechanism to overturn them, something called the Congressional Review Act, which was created in the mid 90s by the Newt Gingrich Congress, and Congress can pass a congressional resolution of disapproval to overturn regulations passed in the last few months of finalized in the last few months of an administration. And there's a very complicated formula for determining when that clock starts. We believe that anything issued before late May by the Biden administration is probably safe, but later regulations, including the more recent and controversial final mental health parity rule, could be subject to a Congressional Review Act override should Republicans want to go that route.
Interesting. And you mentioned lame duck earlier. Tell us more about that.
Sure. So government funding ends on December 20th. The fiscal year ends September 30th. Before the current 118th Congress went out to campaign, they passed a continuing resolution till December 20th. Everybody in DC, myself included, wants to get home to celebrate the holidays. Nobody wants to be here in the waning days, but they have to figure out how to fund the government. And it has been very challenging for this Congress to agree on spending. There's also a lot of pent-up demand for legislation, including PBM legislation, that may ride with this must-pass funding bill. And there are a number of healthcare programs whose funding expires at the end of the year. So there's a need to find offsets for them. So it'll be a very busy time. And Congress will be doing the current Congress's business, but also begin some of the next Congress's business. New members will be coming here for orientation. Fun fact, if a race hasn't been called, both the Republican and the Democrat get to come here for orientation till the race is called. And starting next week when they come back, we will also, at least on the Republican side, have leadership races for the House and the Senate caucuses.
Super interesting. Thanks for sharing all that, Julie. So, you both, just a few minutes ago, you kind of talked about some of those major healthcare issues that you've been following with the election, right? And, we kind of talked about how healthcare itself really wasn't a major emphasis for the Trump administration's campaign, really, right? Certainly, healthcare is top of mind for stakeholders. Let's dig into, I guess, what some of those healthcare issues are a little bit more. I really want to kind of focus on the drug pricing, institutional reforms. If you would, Julie, maybe if we could start with a PBM piece. So maybe what are some, 2 or 3 key issues that we need to be specifically aware of in terms of impact to PBMs, right? What does this potential Republican trifecta have on PBM policies?
Sure. I think a key thing to keep in mind is that PBM reform has been bipartisan and bicameral. Almost a year ago now, the House passed the Lower Cost, More Transparency Act, which has a lot of provisions on transparency for many parts of the healthcare supply chain, including PBM. So the issue of transparency has been very bipartisan. Many policymakers and stakeholders are interested in going beyond transparency. So they've pushed a ban on spread pricing, which is one way that PBMs can get paid. Some have also pushed a new concept called delinking, which means that PBM's compensation cannot be tied in any way to the price of the drug. So I think we'll continue to see more action there, as well as the aftermath of the implementation of the Inflation Reduction Act. This Congress has just been doing oversight with Republicans taking over. That we assume that will be very much amped up.
Yeah, and I would just add to that what remains to be seen, because even though this is a bipartisan issue, of course, as Julie mentioned, the details are, I think, what kind of gets hung up between the parties and between different factions within the parties as well. And so I think what we'll be watching for is for these different policies that Julie discussed, to what extent are they going to be implemented in, Medicare or Medicaid or the commercial markets, because there are differing appetites to regulate those different lines of business depending on whom you speak with.
Yeah, the other thing to keep in mind is, as I said, there is a lot going on the Hill when they come back for this lame duck session. The biggest thing is needing to find the government, and getting agreement on that is not so easy. So while there was massive congressional activity and hearings on drug pricing reform, including PBM reform in this outgoing Congress, whether they'll have time to get to drug pricing reform in the closing days of this Congress is not yet clear. And while there's a lot of bipartisan agreement that something needs to be done, as Caitlin said, coming to final consensus on those details is tough. There was opportunities in the first quarter of this year to pass something, and it didn't happen because all the authors of the various committee bills wanted their piece had to be in it. So whether or not they'll be able to break through that yet is TBD.
Yeah, well, I'm so excited that we have your expertise to help us understand all this and track all this. I can only imagine what your day-to-day must look like. Very interesting. And so let's keep on that same theme of drug pricing reforms, right? Caitlin, what about, some key points with pharma when you think about that?
Yeah, so with regard to pharmaceutical manufacturers, I think what we're watching is patent reform. And while historically that has had maybe not the most popularity as a potential drug pricing policy in Congress, we've seen some things that indicate kind of a sea change in how we view that. And it's increasingly looked at as table stakes in this area. And Julie can elaborate on it a little bit, but there was a patent reform bill that did pass the Senate, I think, unanimously with very little debate. And I believe it was scored with savings. So when Julie was talking earlier about offsets and pay-fors, that's something that folks who are looking to fund the government in the lame duck could look at. And the other thing is 340B. I think it is a bipartisan idea that the 340B drug discount program is one of those things that's long overdue for some guardrails and some additional, beefing up of the statute, because right now it's basically a paragraph from a 1994 law, and then, some subsequent guidance, much subsequent guidance from the federal government. And it has grown substantially in the last decade or so. So, there have been so many approaches on 340B. There was a bipartisan bill, there was a Republican bill. I think there was probably also a Democrat bill. And because of all those bills coming out, I think we are more likely to see something pass on this, not necessarily saying in the lame duck, but maybe in the next Congress when they get through some of the other issues that are higher priority. Because now, right, with one party in control, they can kind of control the exact approach that they would like to see, because there were some differences between how they would like to see that addressed, depending on the party.
And Julie, kind of as we kind of keep kind of moving along, like, do you expect health insurance reforms, now that Republicans are predicted to control both chambers? Is that something you expect?
Sure. I think it's really important to remember that we're not in a Trump 1 administration. So the Affordable Care Act is very embedded in the fabric of America now, and it is super popular. So, and Republicans are well aware of that. So I think we will see some attempts to tinker, but I don't think there'll be an attempt to get rid of it entirely. One thing that's really important to keep in mind is at the end of 2025, the Trump tax credits expire. Now, why am I mentioning this on a healthcare podcast? Because the other thing that expires at the end of 2025 are some major changes that were made to the Affordable Care Act in the midst of the COVID pandemic, which extended tax credits up to 400% of poverty for people getting the ACA. And it made the ACA much more affordable for a wider swath of people. Republicans have said that they're opposed to this expansion and want to see it not renewed. It also costs, by the way, about $1/3 of $1 trillion, which is not chump change, even in Washington. So if we get surprised and the Democrats end up holding the House majority, I think a lot of people think there could be a trade of extending these ACA tax credits for extending the Trump tax credits. And this will probably be done in a bill called reconciliation, where you only need 51 votes in the Senate to pass it.
Interesting. Anything else you'd add, Caitlin, to that?
Yeah, so I think we've also seen a beginning focus, particularly on the Republican side, on kind of modernizing and possibly reforming, in some respects, the ERISA. So Julie might be able to say more about that. I don't think we know what those details look like yet, but there was a request for information that was public, I believe last year or this year, that kind of got a whole lot of feedback from the public, and there were some hearings on this. So that may also be a focus at some point of Republicans. And also in terms of Medicaid, I think we are expecting to see some changes there. The three things I'm thinking of is there may be some more flexibility for states in terms of what they would like to do with their own funding and their programs. You know, they may leverage the waiver program to do that, and some of the waivers that might have been denied under the Biden administration, they may resurface. And additionally, it's looking likely that potentially work requirements for Medicaid may be looked at again. Julie, do you have anything to add to that?
Yeah, sure. So in the campaign, President-elect Trump said that he would not touch Medicare. And we need to find money to fund the continuation of the Trump tax credit. So I think Medicaid is likely where he will go. And Maryam, you had asked about insurance markets, and I think with the Affordable Care Act, we will see a lot of the moves we saw the Trump administration do the first time. So short-term limited duration plans will be back again. Many of those, for our audience, important to remember, do not cover prescription drugs. Republicans have long been enamored with association health plans. So I think we'll see a different emphasis in the Affordable Care Act markets. Under the Biden administration, navigators, which help people enroll, and there was a lot of publicity about the Affordable Care Act. We didn't see that with the last Trump administration, and I think there'll be less of a push to have people enrolled there. And there are a lot of Republican think tanks who want bigger changes without 60 Republican votes in the Senate. I think larger changes are less likely.
So then, no, that's really interesting. Thanks both for kind of helping our listeners understand that a little bit better. So we actually had a recent Pharmacy Friends podcast. I had the pleasure of chatting with Jason Moore and Angela LaRue, who are from Prime's government programs and the operational compliance teams. So we talked about the IRA, and we were really focusing on drug price negotiations, Medicare redesign, and such. And so, Julie, when you think about the IRA, right, what does the future of that piece look like? Is it here to stay? Do you expect changes there?
Sure. Well, one thing to keep in mind is that when the IRA passed, it did not get a single Republican vote. Obviously, the IRA is bigger than the healthcare piece that we're talking about, but I don't see it being overturned because, again, Republicans will not have 60 votes in the Senate. However, there will be increased oversight, And we could see some tinkering on what drugs are eligible to be negotiated under the program. The other thing to keep in mind, you had asked earlier about midnight rules and what the Biden administration may be doing. One of the next big deadlines under the IRA's drug pricing provisions is the next list of drugs potentially eligible to be negotiated is due out February 1st under the IRA law. If I'm in the outgoing Biden administration, I'm going to rush that list out before the January 20th inauguration of the new and old president, Trump. So I think we'll see that. And then the provisions to change the Part D benefit to make it more affordable for beneficiaries were largely bipartisan. So I don't anticipate a lot of changes there.
All right. Well, let's shift our focus to the state side with state governor and legislative races. Caitlin, I'd love to learn about the state of the gubernatorial and state seats. What's happening there?
Yeah, so there weren't a ton of gubernatorial elections this year. There were about 11 seats up, and from what I've seen, it doesn't look like any of them flipped parties. There were a few that I think both Democrats and Republicans felt like might be in play for a switch, but it looks like none of them switched. Interestingly, in 2026, there will be 36 seats up for governor's election, so that will be a much more impactful year for that. And the next thing that's important is the state of the trifecta. So we talked a little bit, we referred to trifectas in the federal sense. And in the state sense, it's the same. State government trifecta means that the same party controls the governor and all chambers. I say that because one state just has one chamber of state legislatures. So with that, the significance of that is that it is much easier for legislation to pass. A higher volume tends to get through, kind of just like with the federal government. If you have a divided government, there can be deadlock, there can be roadblocks, and a lot of the details of legislation get compromised and are slower to pass. But with, a trifecta in place, you see a lot more volume. And in terms of the trifectas, coming into this election, there were 40 of them. There were 23 Republican trifectas and 17 Democratic trifectas. There really appears early on, there's still a lot of tallying to be done, but so far it looks like Minnesota and Michigan have potentially or are predicted to lose their trifectas. It looks like in both states, it's the House that has lost the party in control. So those are both Democratic trifectas previously. Now they are divided. And in terms of that, the one thing that I learned when I was doing some research for this, I learned that there were 7,575 state legislators in this country. I think that is pretty phenomenal to know that there are that many people working in the state legislatures on behalf of their constituents. So I think that's really interesting.
Wow, over 7,000, over 7,500, really.
Yeah.
Wow.
Yeah. Mm-hmm.
Okay, I did not know that. Interesting. Caitlin, so we spent quite a bit of time, like with Julie in particular, talking about that, what's going on at the federal level, right? As you think about this from your perspective, how does all that stuff that's happening at that federal level impact what you're seeing in the state legislatures as we think to next year, right? Especially around drug pricing issues.
So this is an interesting question. So there is a long-held belief that the activity or lack of it at the federal level really drives the feeling of responsibility among state legislators to solve problems, right? And that's also true of drug pricing reforms. And so particularly for pharmacy benefit manager reforms, where we see almost an increasing number of pieces of legislation impacting our industry and, the drug supply chain in general every year. But what I think is possible is, with any legislation that's passed in 2025, that might kind of vent some of the pressure at the state level in the 2026 state legislature, but not likely much impact in 2025.
Really interesting. And so I guess what's, as you're thinking ahead, like what's that, I guess, volume of legislation that you're tracking as you're looking ahead?
Yeah, I think the drivers of volume that we're expecting for 2025, it'll be a lot of the same stuff that we've been seeing. And in particular, I think pharmacy network issues. So state laws that would seek to regulate contracts between payers and pharmacy benefit managers and other types of administrators and pharmacies. And in some cases, pharmacies and other types of arrangements that they have, like wholesalers or PSAOs. But we're also seeing a couple of issues that we think will increase this year. And interestingly, prior authorization is one of those issues that we're expecting to see a lot of legislation on. In previous years, there was a focus on gold carding at the state level. They've kind of transitioned in a lot of states to looking at categorical exemptions from prior authorization. So, for example, no prior authorization on mental health medications, that kind of thing. And what we're expecting is, for that to ramp up, particularly with the tone and tenor of some of the media coverage on prior authorization this year. And also, another interesting note, I really suspect that a lot of this discussion about prior authorization is coming from the proliferation of weight loss medications and GLP-1s. We really see sort of a correlatory rise in the discussion of both of those issues. The other thing I think will be pharmacy reimbursement, and it does kind of fall into what I talked about earlier with contracts. But there is an increasing call at the state level for states to mandate or benchmark particular reimbursements to pharmacies for medications, which is kind of switching from the system that we have now, which is more of a negotiation between two parties way of going.
Mm-hmm. So, ladies, we're through this election cycle, right? Where does your focus go next?
Yeah, so obviously, we're not that far away from the 2025 state legislatures. So, as a policy professional, government affairs professional, I'll really be looking at national trends and what's going to happen in those 2025 state legislatures across the country.
Julie, how about for you?
Well, I will have a lot of new friends to make in the new Congress, so that will be part of it. But before we even get there, I'm going to be very busy starting next week through the end of the year, watching what the lame duck may or may not do on PBMs and more broadly, other drug pricing reforms.
That's great. Well, I think, as I think about Prime too, right, as a healthcare company, our focus on affordability and our commitment to our clients and members, to continue to be a transparent pharmacy solutions partner, right? I mean, we provide savings, simplicity, solutions, support for our stakeholders. So, our leadership will continue to move that forward, which I'm really proud of. Well, as we start to wrap up, as a podcaster myself, I've noticed the role of podcasts that they've played, I guess, in the election, especially I would say in the last month or so leading up to the election. And I'm sort of wondering if either of you are into podcasts or if you have any favorites, of course, besides Pharmacy Friends.
Well, I love Pharmacy Friends, Maryam. Your podcast is great. And I think, for those of us within the company, it's an opportunity for us to learn about things that we maybe don't have exposure to. Particularly, I loved your episode. I mentioned GLP-1s earlier. Loved I think it was a two-parter on GLP-1s. Really enjoyed that. And my podcasts are about to get a lot thinner because I was consuming a lot of election-focused content in the last 6 months. But for fun, and maybe this is not that fun to some people, but I really enjoyed this podcast called Slow Burn, and in particular, seasons 1 and 2. Season 1 focused on Watergate, which, their focus is to kind of go through the events as if you were living through them at that time. So it's a really interesting way of unfolding the story. And then season 2 was on the various scandals of the Clinton administration in the 90s. So I really enjoyed that.
That sounds awesome. Julie, how about you?
Besides Pharmacy Friends, I am not a big podcast person, but driving to the Hill in my daily life, I love listening to audiobooks. And 2 recent favorites are both by Kate Quinn. For those of you who love historical fiction, and I sometimes need to escape the present day and constantly reading about health policy. So the Kate Quinn books I've loved recently were The Briar Club, which is actually set in DC. I did not know there was a big organized crime gang in DC in the 1950s and before, but apparently there was, and The Diamond Eye. And then another book I loved recently is The Wedding People, all wonderful audiobooks for people who want to listen to something a little bit differently.
That's great. Yeah, I mean, the traffic in DC can be brutal, so an audio book is great to keep you company as you're driving to the Hill and back. Well, ladies, thank you so much for sharing your insights, and I hope you come back and visit me again.
I'd love to. This has been a blast. Thanks so much for having us.
Yes, thank you so much for the opportunity. It was really lovely chatting with you.
And to all of our listeners, as always, thank you for joining Pharmacy Friends. Wow, just fascinating. We just got a sneak peek into how our experts see what the election results could mean to America's healthcare industry and what topics might be on the top of the list for discussion. Thanks for listening, and be sure to follow Pharmacy Friends to listen to more insightful conversations about the pharmacy industry.